Well, there's big news this week out of the American Academy of Pediatrics. They updated their guidelines for how to treat obesity in children, and there are differences based on the age of the children. A lot to talk about here, including not just medications and surgery, but also comprehensive changes to how we think about entire families and how they eat. So a lot to talk about here, and I'm very happy to have Dr. Bhavna Sacheti, a pediatrician with ProHealth Physicians, to sort of go over some of those biggest changes. Doctor, thank you for joining me today.
Thank you so much for having me.
Yeah, glad to have you here. And there is a good common sense element to a lot of these changes that we were just talking about before. Getting the family involved, something that wasn't really, I don't believe, part of the recommendations before.
No, and this is the first major consensus clinical practice guideline that has ever come out from the American Academy of Pediatrics, which was, published and made public just Monday this week, and it's a big deal. Obesity now, 1 in 5 children in the United States is obese.
Yeah.
14.4 million children in the United States currently right now are obese. And obesity has long been stigmatized as something that is a reversible consequence of one's own personal decisions. And now we realize that it is not that. It is a complex disease with psychosocial, genetic, environmental, and socioeconomic contributors. The concern is that kids that are obese become adults that are obese. We used to always think that they'll outgrow baby fat. We know now that that's not the case. And those children are then at risk for all of the problems that adults have when they're obese. High blood pressure, diabetes, bone and joint problems, mental health issues. All of those things are going to become theirs. And so we have a lot to do, but the good news is that it's treatable.
Yes, yes, and boy, we see this a lot, that people tend to oversimplify something that's multifactorial. What I like to see is that these new recommendations, in a way, are multifactorial too, because they involve getting the entire family involved. How so?
So the clinical practice guidelines have two parts. There are consensus recommendations, and then there are these 13 key access statements. And those statements start with having, at every kid's annual physical, age 2 and up, getting a height and a weight and a BMI, which is a marker that takes into account your height, your weight, and your age to come up with a number that helps us estimate how much body fat you have. And that really helps us to start to screen. And so then we start screening blood pressure and doing blood work at times if the kids are overweight for for diabetes, for liver function, for any of these problems that can then become issues. And the recommendation is what exactly you're saying: intensive behavioral health and family therapy. And the studies that were done were comprehensive, and what they found was that the success was the most with more than 26 hours of face-to-face family therapy that is multifocal over a period of 3 to 12 months. And that's the key, because it has to involve every part of the family structure in order to help a child.
Of course. It makes such common sense. It's one of those things that makes you think, why wasn't it treated this way before? Parents have as much of an impact on what a child is eating as the child themselves. And I say we tend to oversimplify things. Well, we're about to oversimplify things here now, because there's a lot of different guidelines, but I think one that's raising a lot of eyebrows is the idea that in children 13 and over, they should be screened for possible bariatric surgery, major surgery. What are your thoughts on that, Doctor?
So the first line is always going to be the intensive behavioral therapy and lifestyle change, whole intensive therapy program. For children 12 and over that are obese, the recommendation is now going to be to start with also weight loss pharmacology. And for children that are severely obese, so these are kids whose body mass index is over 120% of what would be considered normal. Those kids, early referral to a comprehensive bariatric surgery program is the recommendation now, and early intervention is going to be more beneficial to them than watching and waiting.
And I think that was the other big takeaway, this early intervention, because just how strong is that correlation between childhood obesity and adult obesity? I mean, it's almost literally 1-to-1, I think.
It is.
Yeah. Were there any other parts, and again, in the little time we have, that you thought that were very noteworthy, or at least represented a big change from what the previous guidelines were, Doctor?
So I think that involving the entire family is the thing that I think is the most likely to be successful, and the part of it that I'm most excited about.
Yeah, easily. Doctor, thank you so much for taking the time to join us here. Of course, a lot to go through here, but it was a problem that you were even saying was big before, and then after the pandemic sort of hit us and people were staying inside, that managed to grow. And yeah, using the body mass index, the BMI, certainly a good way to start these discussions to see where your child is on that spectrum. Doctor, thank you so much for taking the time to join us.
Thank you very much for
Dr.
having me.
Sacheti, thank you so much.